Welcome to Conducting Assessments Part 2. Now this is a continuation of Conducting Assessments Part 1, so if you haven't seen that one yet, you'll want to view that one first. Our subject is Conducting Assessments on the NBRC Clinical Simulation Exam. As we established in Part 1, one of the key challenges with conducting assessments during a clinical simulation is knowing exactly how much information to gather, when to discontinue the assessment and go on to treat the patient, and when to stay on the menu and further the assessment. To help us with this, we've recognized earlier that we must gather information in the correct order, and that correct order consists of levels. Let's take a moment and take a look at some information to refresh ourselves of these levels. Now here before us we have 4 different bodies of exams, tests, observations, whatever you'd like to call them, but these are the kind of assessments that we'll perform on a clinical simulation exam. Let's focus for a moment on the Level 1 information in the upper left-hand corner. If you look at these things, they all have a few things in common with one another inside this group. Now look closely to see if you can figure out what that might be. Well, if you think about it, all of this data in terms of how long it takes to get the results is fairly quick. It's quick because it's mostly just visual information. Now even you'll notice the VQ scan, which you may say to yourself, that takes a long time to do, it has to be interpreted, typically takes a lot of time to get the results. Notice that it doesn't say VQ scan, it says VQ results, and this means that the results have already been reported. And all you have to do is look at them, and that's a visual process. Here's another consideration for this group, and it may seem odd, but these exams do not cost the patient anything, so they're not typically billed for these. Now you might wonder, what does that have to do with the NBRC exam? And the answer is a lot. NBRC is sensitive of cost of exams, and they generally assert that we should be trying to establish an understanding of the patient's condition at the lowest cost possible. First, we'll do the simple test, and then we can proceed to more complex and expensive tests as needed and for diagnostic purposes. So to recap, Level 1 is quick, visual, and free. Now let's slide on over to Level 2 information over in the upper right-hand corner, and let's take a peek and consider these same topics. Now these exams are also quick, but let's just say they're pretty quick. And what we mean by that is that they're not quite as quick as Level 1. They're more than just visual. If you look closely, you might have to interact or touch or talk to the patient significantly. That may consist of putting your stethoscope on them and asking them to breathe, or asking them to exhale on a peak flow meter, those kinds of things. But you get the idea. Now let's take a look at Level 3 information. What do you see there? Well, first of all, can you see that the results in this category take a little bit of time? I mean, it may be as little as 10 minutes as in the case of an ABG, but it could take several days as it would with a culture and sensitivity. The point is, if you discover that the patient was in an emergent condition, for instance, if you walked into the patient's room and noted immediately that they had no chest movement or rise, you could conclude that they had no ventilation. And by the way, we gathered that information visually, so that would be Level 1 data. So if we knew that the patient was not breathing, even getting a relatively quick blood gas would be too time-consuming. We should be reaching for a resuscitator bag rather than an ABG kit in our pocket. In addition to the time the Level 3 data takes, it's also going to cost the patient. In other words, the hospital is definitely going to bill for that ABG, sputum, CNS, or X-ray, or whatever it may be. And so that automatically indicates that's a little bit more of a complex test, costly test, and it should be safer later if possible. Now, if we slide on over to Level 4, what we see here is either very expensive or time-consuming, such as a CT scan, or perhaps not necessarily expensive, but very specific. Take a look at a sweat chloride test. It's relatively inexpensive and a fairly quick laboratory value to obtain, but it's only done on one type of patient who we suspect may have cystic fibrosis. So that's Level 1, Level 2, Level 3, and Level 4 information. Now keep in mind as we back off, when we look at this information again, we're not able to list all of the Level 1 tests or all of the Level 2 tests. We can't give you an exhaustive list of all these things. What you'll also need to do is to be able to look at a test and understand how to determine what level it is. So just to recap here, another way of looking at this, if you look at Level 1 information, anything that as you approached a patient's door, opened their door, stood in the doorway, that you can assess from there, in other words, the information that you can see, respiratory rate, you could see general appearance, you could see their color, You can see their chest rise. Anything you can see from there would be level 1 data. Now for level 2 data, we'll have to step up close to the patient, probably touch them, certainly interact with them a little bit, give them instruction, put stethoscopes on them, listen to their breathing, maybe ask them to perform a specific simple pulmonary function maneuver. That would be level 2 information. Keep in mind that as we get that information, the results come also very, very quickly. We have the results as soon as we're finished with the maneuver or the patient finishes responding to our command. Now, take a look at level 3 now. If we want to do level 3 information, now we can assume that the patient is giving us something. We're going to take blood, money, it's going to cause pain, we may take some sputum, we may take some urine and analyze that. We may even do a chest x-ray and kill some of their cells with the radiation. So the point is that it's going to cost the patient something. If it starts costing the patient anything in any of these terms, then it's probably a level 3. And then, of course, a level 4 is that much except even more. It's very expensive or very time-consuming, or it may just be very, very specific. So in order to conduct an assessment in the right order, we do so by levels. And the critical skill is the ability to look at any exam that we show you, and you determine and decide what data level it is. Is it a level 1, 2, 3, or 4? Now, we'll practice this in a moment, but let's be clear about what we're supposed to do with this information. During a clinical simulation, when you're faced with a dreadfully long list of tests or exam options, you're not going to simply start at the top and go down the list and say yes or no to anything that sounds appropriate or not right. Rather, you're going to start at the top and proceed down carefully through the list with the intention only of picking the appropriate exams that are in level 1. And then next, here is where the magic happens. You must stop after each level and look at the results. Your intention here is to analyze and decide if you have an emergent condition on your hands or not. In other words, do you have time to proceed to the next level? In this case, we're on level 1. Would we have time to go to level 2? Or should you discontinue the assessment and leave the scene and attempt to save the patient? Now, what is considered an emergent condition is something that we'll more fully go over in another tutorial. But essentially what you're looking for is any life-threatening situation. And to put it more bluntly, do you have the data that says if the patient is not treated, that the patient could immediately die in the next 1 to 10 minutes? Now, that's not an exact science, but if you do have that kind of information, then you're going to skip all the other levels. You're not going to go on to the next level regardless of what it is. Here is what you will do. You will finish that level, and then you'll go on to the next section. Now, for instance, in this case, we look at a level 1 information, respiratory rate, and that's 5, and that's not enough to sustain life. And so right away, we know the patient is in an emergent condition. If they continue at a respiratory rate of 5, they may only last just a few minutes. In addition to that, we also see that there's markedly diminished or decreased chest movement, also a sign that the patient is in dire circumstances. So in this situation, that's level 1 information. That means we would not go to level 2. Even things like breath sounds or simple things that are found in level 2, we're not going to do that. We're not going to reach for a stethoscope when we really need a resuscitator bag. Now, as we look at another situation, remember this was level 1, but as we proceed, we might find out that in level 1 we did not find emergent information. Oh, the respiratory rate may be a little bit diminished, and we don't like the breath sounds, or colors looking a little bit bad, but it doesn't mean that, of course, they're in an emergent situation. Remember, we'll cover exactly what's an emergent situation in another tutorial, but if in level 1 we were to decide the patient looks poor, there is some concern there, but it's not emergent information, or in other words, the patient's not about to pass away in the next 1 to 10 minutes with this information, then we could progress to level 2. Again, that information is also very quick, and here's an example of what we might find at level 2. We might get to level 2 and there then find some emergency information. In this case, we see that the breath sounds are absent. That just means on the NBRC exam that there's no ventilation. Or also, we also have a tidal volume that's so low that is definitely not big enough to sustain a life for a typical adult. And so these would also be examples of emergency information. In this case, we would finish picking anything from level 2. That's where we found the emergency. But what we would not do is go to level 3. We would go ahead and hit the button on this clinical simulation that said go to next section in hopes that we might be able to provide ventilation or other life-saving procedures for the patient. Now that we know how to gather information in the right order, and analyze in between levels, looking for emergent situations that are life-threatening conditions, now we have to make sure that we have the ability to look at any exam. Because we couldn't list them all exhaustively, there's hundreds of them, we have to be able to look at any exam and determine on our own what level they are. So are they level 1, 2, 3, or 4? Obviously, if we can't do that, then the system is not really helpful. So keep in mind then, as you go through this next activity, you're going to be asked to put your mouse on a test and grab it and drag it over into the right bucket. And those buckets are level 1, 2, 3, and 4. Now keep in mind and use the criteria that we taught you. Level 1 is going to be visual, quick, free information. Level 2 is going to consist of information that we have to interact with the patient with. Level 3 is going to start costing the patient, and time is going to be consumed in getting the results. And generally it's going to cost the patient not just money, but blood, urine, perhaps sputum. Maybe we'll kill some cells. Maybe it's going to cost them a lot of pain, but it's going to cost the patient something. And then of course level 4 is something very, very expensive, very, very diagnostic, or very specific to a specific disease. Very good. Now look closely at this data and make sure you understand why each test is in its respective bucket or level. Let's try again. All right, you did it again. Now try this one. You are right. Now did you notice in this case it had amniocentesis results, which is a little bit different. And as we think about an amniocentesis, that's a terribly invasive, expensive, possibly painful, and possibly dangerous or risky procedure. And yet we've classified it as a level 1. And that's because it doesn't just say amniocentesis, that's the procedure, but it says amniocentesis results. So this is the results of the test, meaning the exam's already been done, and all you have to do to get that information is just to look at the report, and therefore it's visual or level 1 data. Now, if it was amniocentesis by itself, that would definitely be a level 4. Okay, let's try another one. Well, it looks like you're an expert now. Did you notice on this one that a 12-lead EKG is level 3, and that's because it costs something. It also requires interpretation by a cardiologist, and that interpretation is going to take some time. This concludes the module Conducting Assessments Part 2. Remember, this is in conjunction with Conducting Assessments Part 1, and if you need to review, you'll want to review both of those tutorials.